Welcome back to With Love Mama, the podcast, or if this is your first time here, welcome to the podcast. Today is very exciting because it's actually my first proper guest episode. I have the beautiful Chelsea here. Hi.
Hi.
Did you want to just actually explain just a little bit about who you are, what you do, just so the listeners know what we're in for?
Yep. I am an osteopath, and in recent years have just done extra study in pregnancy, birth prep, pelvic health, all of that good stuff. Pretty passionate about helping women through their pregnancy journey.
Slay. And I was seeing Chelsea in my pregnancy with Kodak, so my first pregnancy, and I feel like osteo was such a huge part of my birth prep journey. I should probably actually come and see you this pregnancy.
Yeah.
I'm like, oh my gosh, all the things that you it's funny because your first time you want to do, well, for me anyway, I was I want to do all the things, and I did all the things, and I had the most amazing labor, birth, everything. And then the second time it's I've already done it, so I'm good, but it probably would be good to come and get checked. So I wanted to start just with asking, so we're going to sort of focus a little bit on the pregnancy side of things, and then we'll talk a bit about birth and preparing for birth, because I think it's really cool as well if you are preconception or pregnancy, there's not really a too late time. Oh, I guess there probably is a too late time, isn't there?
Yeah. I find patients probably have the best outcomes coming in the earlier the better. So I've seen people preconception and early through pregnancy, and I find they probably have the best birth outcomes of what they want to achieve by coming in earlier. I think if you're coming in, say for birth prep at 36 weeks, and there's sort of things in the body we need to work on, it's a little bit still good to come in, better than nothing, but it's a little bit harder to get to where we want to be.
Yeah, we want time on our side, I guess.
Yeah,
hey?
absolutely.
Because if you 36 weeks, and then you're going and you're oh, I want to completely unmedicated labor birth, this is I haven't done any prep, you know, they do recommend 20 weeks to start birth prep, is that right?
About that time's good. So because it's more of the physical side of things, I think it's good around that time when you're starting to get a bit of a belly and your body's changing, and we want to nurture those changes as we go through.
Definitely. And I feel with second, third, fourth pregnancy as well, definitely, because you know, I feel even this pregnancy I've been getting a little bit of that round ligament pain. Didn't get it with Kodak, but then this time it's because you know, I think your body knows what it's doing, but it just it's asking for a bit of support. So
you've got a toddler, so you're carrying a
seriously.
toddler around and having him on your hip and stuff, so there might be imbalances there that we still need to address.
And exactly. And just some of the stuff we got into when I was working closely with you, pregnancy, postpartum, you picked up on so much in my pelvis and everything. But anyway, we're not here to talk about me. I did want to start with just as a doula, I see women are just being told discomfort is normal, all the time. And I feel it's just a normal thing that people go, I'm pregnant, so this is normal. I've got this pain, I can barely walk, whatever.
Yeah.
Where do you draw the line between normal and actually needing support?
Yeah. I mean, it's common that people get discomfort through pregnancy, but I think it's definitely something that we can address. It's not something you have to put up with. So I guess commonly people get aches and pains, or maybe more severe pelvic pain, pelvic girdle pain, and that's something an osteo can address. So we look at the whole body and its alignment and its function. So you might have tightnesses, some people might have an instability issue. So I talk a lot with patients about the scale of where they are. If they are more of a hypermobile person or more of a stiff person, there's kind of pros and cons with pregnancy for both, and it's just working out what they need. So some people might need stretching, more stretching and release work, and some people might need more support if they are a little bit more unstable with things belly bands and things. So I guess seeing an osteo, we can work out individually what you need, rather than just getting, do this birth prep exercise. It might be really great for one person, not so good for another person.
That is such a great point, because there's so much on Instagram, TikTok, all the things of you have to do this to have a good birth, or you have to do this to just whatever, and it's almost these false promises, because everyone does have completely different, even like, as we'll get into, like the pelvic floor, some people would have like such a tight pelvic floor, and then some people it's actually like, oh, like we actually need to like whatever the opposite, like like it's like so different, like weak and strong. Like I know for me, mine was like overactive, whereas some people's might be like super weak, and you want to try and find that like balance of
absolutely so I think there's no need to be in pain through pregnancy. Like we can understand, and I guess that's where seeing you know, a professional like an osteo or something that to work out what for you is normal and not normal, and whether there's things we can do to help manage it. And again, like seeing an osteo earlier on, I find we can get on top of those imbalances earlier on before it's, you know, later stage, third trimester, and there's a lot of extra weight and things going on. Again, I think getting on top of it earlier is helpful.
And what's your take on pain? Because we were talking about that prior to recording. I'd love for you to share it with the podcast listeners, because I think it's like a really important point that you made.
Yeah. So I guess like pain, like we were discussing earlier, more in terms of when you're, you know, in labor and birth. But yeah, there's sort of I guess pain science comes into it as an osteo. So like there was a study that's often talked about in the pelvic world where they were looking at the tightness or contraction of the pelvic floor muscles. They were comparing it to a normal group and a group that already had vaginismus, so pain within their pelvic floor. And they compared it with 4 different movies. So one was just a neutral movie, one was a sexual movie, one was a sexual threatening movie, and one was a threatening. And they thought pelvic floor would tighten with the sexual threatening movie. And it actually tightened with both the threatening and threatening and sexual threatening movies. And this happened in both groups, regardless of whether you had pelvic pain prior or not. So it shows that how our bodies respond to pain. And you can think of it like when you're in pain, you want to like curl up in a ball, you want to like tighten your body, or you grit your teeth, or so it's all that tension.
Which is, I think, if you haven't done that leading up to birth support work, whether it is with an osteo, with a doula, with whoever you want to work with that can support you, you're going to be perceiving it as a threat, which is I guess what you're getting into, but your body does just want to contract and go inwards, but like I always say, tight jaw, tight pelvic floor, so it's
absolutely.
like you want to try and breathe and like stay calm
and it's understanding. I think it's understanding the pain and what its purpose is, which is something like an osteo and what you do can work with. So, I think when people see pain as a threat, they're going to tighten up. So if they're scared, in a like fearful, scared environment, they're going to tighten up. They're not going to be able to relax and surrender, which we need in birth. We need to feel calm and safe and let go and be able to relax to have... to go through labor.
I think I just want to add as well, like I didn't even think of this until just then. I remember one of the affirmations I was telling myself actually was, this pain has a purpose. Because it's funny, like even reflecting on my own birth, it's like you in the moment, it obviously is a lot on the body, but it's a lot like as well of how you're perceiving that pain. And so like for me, I can say like, my labor was like great because it was, but of course there was pain, but I was perceiving it because I knew it had a purpose.
Absolutely.
And just what you're speaking about, it's like if you don't know the purpose of the pain, or like why your uterus is contracting, then you're going into it like with a blindfold on. And you're not.
Absolutely.
Progression is going to probably be different.
If you don't know why you're experiencing that pain, I think everyone knows birth can be painful, but that's also like a fear response, right? Like I think when I was a kid, I was like, I never want to have a baby because I don't want to go through that fear. Like that's what we're brought up to believe. And I think a lot of people still have that, and they're like, I know it's gonna be fearful, but like, just got to get through it. But we actually have tools that we can use to surrender to the pain. And then, you hear people say it was painful, but it wasn't painful, it wasn't, the pain wasn't threatening to them. So it's just a sensation, really. The pain, when we feel pain, it's a signal in the body. So, if you cut your finger, for example, you might not even notice until you actually look at your finger and see that it's bleeding, and you're like, oh shit, I'm bleeding. But you know, it might have been a couple of minutes where you didn't even really feel that, but because you see the blood and you think of it as a threat.
Yeah.
Yeah.
Isn't that just like so interesting how much like it really comes to perspective and like how you're perceiving it to be.
Yeah. Yeah.
Which is just so interesting.
Yeah.
How, for you, like as an osteo, when you're seeing clients come in and potentially they're sitting more at that like constantly wound up, because like you said, like watching in that study, it didn't matter whether it was like threatening or sexually threatening. If it was perceived as fear, women were tightening their pelvic floor. And you got to think like how many other things are perceived as fear in just our everyday life, even just like the overstimulation from our phones.
Yeah.
People are wound up. Like we're moving through life quite wound up. So when like a woman like comes into you, I've just lost my train of thought.
Yeah.
Oh my God. I'm like, wait, where was I taking that? Do you remember where I was trying to take that?
Let's just try and keep going with it, I guess. Yeah. Like I would have people come in, like a common story I hear is people come in and they go, oh, my body knows what to do. But
yes,
I don't,
okay,
but I don't want to know, I don't want to know any information. Like I often will approach like with clients, I'll go, you know, we'll do the physical side of treatment, but I'll always talk to them as I'm chatting. So I'm go, how do you feel about labor, or what's your rough birth plan that you want to do? And we'll sort of go into that. And some people go like, oh, I don't know yet. I'll wait until, you know, I'm 30 plus weeks and see what the midwife tells me, or, you know,
just giving their own power away.
Yeah. And going, you know, I don't want to know because it's something my body knows how to do. And it's like we were talking about before with like, in terms of, you know, if you are planning to have a vaginal birth or any birth, it's a marathon, right? Like it's known, it's sometimes referred to as a marathon. You can run, yes, but that doesn't mean you can do a marathon. You need to like prepare and train and put in the work to have your body be able to run 42 kilometers. Yeah. So, I guess that's like changing the topic a little bit, but coming to like the birth prep side of things, that's really what our focus is preparing your body to be able to do the thing. Yes, your body knows how to give birth, or it knows how to run, but can it run a marathon? Is it in the right, you know, have we got the like right movement through the pelvis, or like stamina? Do we have, you know, can we withstand like our mindset with pain? It's the same with running a marathon. If someone's like in pain and they're like, you know, their heart rate elevates and they see that as like a threat, they're not gonna do very well through the marathon. So, it's like preparing the mind and body for this event. And I always say to patients, whatever you choose to do in terms of your birth, you want the option that feels the safest and right for you. And you're not gonna know what that is if you don't sort of explore the options.
Yes. Yeah.
Yeah.
Because if you are just not exploring, then you end up going into this not realizing the pain has a purpose, or maybe knowing the pain has a purpose, but it's triggering you in some way, and your mind is just not, you know, potentially as like has that mental stamina. Yeah. Then we're having like an emergency C-section, and it's not to put any blame on like that happening or anything. It honestly, it happens. It happens. But I guess like going into it with no preparation, like you said, you wouldn't run a marathon without preparing. So why would you want to give birth to your child? Yeah.
I remember when we were in your early stage of pregnancy, and you were planning to have a hospital birth, and then, you know, and you were pretty all over what was happening, but you know, you talked about it with Jai and other people and worked out that wasn't where you felt safest. A lot of people might feel fearful being in a hospital setting. And
that's so true. Yeah, we didn't explore it.
We found what worked best for you. So I think just going into it thinking, oh, my body knows what to do, you're not setting yourself up, but you know, you're not giving yourself the best chance of working out what is best for you.
Yeah, I love that. Because it's not taking away that, yes, some women can just go into it and have an amazing experience, no prior research, their body, and every woman's body does know what to do. So we're not saying that you you don't know what to do unless you like put some, you know, time into it. Yeah. But it's also like the actual outcome and like how you feel, because you could, you know, do your research, go see a pelvic floor osteo, realize that cesarean section is actually your best option, and then feel empowered of how you brought your baby into the world through cesarean section, rather than it turning into an emergency cesarean that you weren't prepared for and then feeling like a failure. I think that's like really the point we're trying to get across here. It's not that any type of birth is wrong. It's that
the preparation for it. And I think like there's not, just like being prepared and knowing, you know, you don't have to be an expert in birth and all of that, but just, being as prepared and informed as you can be, I think does have better outcomes.
It does. And I'm sure there's actually studies that actually show that. Speaking about preparation, what does a well-prepared pelvis for birth actually look and feel like from an osteo's perspective? Yeah,
cool. So when someone comes in, again, like the earlier the better. So the earlier they come in, I'm looking at the whole body really is what a pelvic floor osteo would do. I know a lot of people see physios and they're really great as well. They sort of look at the pelvic floor function, whereas as an osteo, I look at the whole body because it is a whole body experience, right?
It really
like
is.
If we're thinking
like my toes were
active
sore
labor, exactly. And you know, so you know, we need to get into different positions. It might be a deep squat, we might be like crawling on the floor, and probably the biggest thing is around the pelvis, which I'll touch on, but the whole body. So you know, I'm looking at how people are breathing, I'm looking at how people's ribs are stacked over their pelvis, you know, even down to their feet, whether they roll in or out through their ankles will have different effects on the pelvis. And then I think the biggest thing that makes a lot of sense to people is I've got a model in my room that it's like just the bony pelvis, and it's got a bit of movement to it. So we can show how the pelvis actually moves. I think it's really important to understand, because some people might think of our pelvis as being just like a rigid bowl, and it's not. It has basically 3 bones to it, and it's got it does have movement, and it has more movement through pregnancy with our increased hormones and relaxin. It makes allows for more movement. So you know, when in our early stages of labor, our pelvis will move, and we need our body to do this as well, like movement through our hips to open up through the top to allow the baby's head to come in. Then through that middle section of the pelvis, we actually want asymmetrical movement. So you might have like one, that's why like crawling on the ground, for example, we have one leg forward, one leg back, and that helps the baby's head move through that part. And then the end part, we want the bottom of the pelvis to open, so the opposite of what we did at the start, to allow the baby's head to come through the bottom part of the pelvis, and that's getting like your sacrum out of the way. So our sacrum will bend back and forth, and at that stage we need our sacrum to open, and that's where the pelvic floor like lengthening and stretching we need as well.
If we can just quickly touch on, can you give for each stage of labor like a good position for women for their pelvis? So kind of with birth positions, what I do is I give people birth positions to practice at home, and it might be more specific as well to what their body needs. I kind of don't try and say too much of do this position at this stage, do this position at this stage, because I think when you're in that labor mindset, you know, you're in that other world. You're not thinking, oh, what did Chelsea tell me to do at this stage? What stage of labor am I in? I always say to patients, that's so true as well, because you don't actually, well, I don't know.
Yeah, you don't
your body
consciously
actually
know.
Your body,
it's a subconscious.
Your body just guides you really. If you allow it.
So I find I educate people on those rough movements of the pelvis and what positions might be helpful. Say a deep squat or crawling on the ground or stomping their legs or you know, whatever it is. And then I tell them, like, when you're actually in labor, your body will know what to do, and you'll crave, oh, I really want to be in a deep squat, or I really want to be crawling on the ground. And I always say to people, your body will know when it's not right. Like if you're in a deep squat, it might feel really good, and then all of a sudden it doesn't feel good, and you're like, your body wants to change. Then change and do something else, and that's your body knowing where you're at. So I think as long as we have these different positions in our head and we've practiced them, so we know our body can do them, and then in the moment we'll pick and choose what we want, because
Yeah.
for one exercise for one person might feel really great, but not for another. So it's having those exercises and positions in your head, and then in the moment your body will just know what feels good, and if it doesn't feel good, I would say move, change, and do something else.
Yeah, and I think that's like where like even like my work as a doula comes in, of like guiding women to trust in that intuitive nudge that you're getting.
Yeah.
Because it can be so easy to like look at your midwife or look at whoever else is in the space that you maybe are putting on a pedestal because they've birthed before or whatever it is.
Mm-hmm.
But it's so key to remember that your body's communicating with you before it's like, before even you're showing signs externally.
Yeah.
So like if you're feeling like this is too much or whatever, roll with it.
Mm-hmm.
So I just love that advice, because it is also, again, even after I asked the question, I was like, isn't that interesting? We were just saying like it's different for every woman. And then I'm like, oh, can you give us this for each stage? But it's like, no, because it's so individualized. There's not a guidebook to have a perfect birth, because it's actually based on 1, preparation, 2, following your intuition, and 3, knowing what to do.
Everyone's bodies are different. Like some people can squat really easily and some people can't, and like, so it might not work for them.
Love literally love. What is the difference between staying active in pregnancy versus actually preparing the body for birth?
Okay. So I do encourage people to be active through pregnancy. I think like when we're talking on exercise, it's probably a common question. People are like, what do I do for exercise? I always say, good to continue. If you feel good and feel up to it, continue what you have been doing. And
don't
so
go add in like a 5.
Like if you've never been to the gym, don't start going to the gym when you're pregnant. But at the same time, I think if you are sort of consciously conceiving and in that preconception phase, I know there's a little bit coming out on that, like on Instagram at the moment. I don't want people to feel pressured, to be fit before you're pregnant, because sometimes, pregnancy might be a surprise and you can't do that pre-work then. But I think being the stronger and fitter that you can be pre-pregnancy can have good outcomes, because then you might find that you can stay a bit more active through your pregnancy. But yeah, even things like walking, again, it's so individualized, because some people, they might have pelvic pain and walking maybe is too much on their pelvis, depending where they're at. But as a general rule, being active through your pregnancy does tend to have better outcomes. And so that in itself is a bit of a birth prep that you can do. I think it's better. It helps birth outcomes, yes. And then there's probably specific, like we were touching on, with certain positions and exercises to help that active birth, active labor. And I think like what I'm taking from that is like the biggest thing is, don't just go and add something because you feel like you should. Like just really rolling. Again, it's like so interesting, because like you're literally a doctor in like osteopathy. Is that how you say it? Osteopathy? Osteopathic.
Osteopathic doctor over here.
Better than osteotherapist.
Literally saying, basically, without saying, just go with your intuition of what feels good. And walking is so good for your like abdominals.
Absolutely.
And like I think people just think like, oh, it's just walking, that's not exercise. That is like that, and that's just me speaking from like my own background, but it's like, go, like if that's all you feel good doing or can do, that's actually insanely good for like birth preparation.
Absolutely. Yeah, the abdominal ones is interesting, because again, a confusion probably with people thinking, some may think it's bad to do abdominal exercises. It can be good to do abdominal exercises, but we want to pick the right ones. I think we might have gone over this a little bit with you.
Can we touch on this? Because like I think people think, oh, we want strong abdominals for pregnancy and labor. 100%. But what does that actually look like? Because it's not crunches.
Yeah, absolutely. I think, again, it comes back, I like using the term functional. So again, with like pelvic floor as well, we don't necessarily want a strong, tight pelvic floor. We want a functional pelvic floor, something that can contract and relax. I can come back to an analogy for that one too. But with the abdominals, again, we want functional. We don't want, if we have super, super tight abdominals, we do need them to stretch to a degree to allow our belly to grow and to allow bub to have space. Because if we are really tight, it's something I look for a lot. If we are really tight through our diaphragm, through our bellies, bub then doesn't have as much space then to move and flip and do what they need to do. And sometimes that can contribute to baby being maybe in the wrong position or being stuck. I know like in terms of breech babies and spinning babies, a lot of that is creating space around the pelvis and around the belly. So if we're really tight, bub might not have as much room to spin and grow and do what they want to do. And then we may also have, maybe a weaker abdominal muscles. And for that, we do need a level of tone and strength for labor. Those early stages of labor, like if you think of your belly's out here, we need some contraction to be able to almost bring the uterus up. And so the baby's sort of up and down into our pelvis. If they're really sitting forward, they've got to come down into our pelvis, but they're sitting almost out next to it if they're really sitting out. So again, it'd be individualized then in what you need. I don't want to say everyone needs to do this, but in terms of crunches.
Yeah, like what are definite no-nos for every pregnant
woman? I mean, like crunches is probably not the best thing, especially later stage pregnancy, but I really love doing, I call them like a belly hug or a baby hug.
Yes.
I think we did this with you, like on all fours and just breathing and moving with your breath. And I find a good exercise then is sort of like giving your baby a hug. So like drawing in, lifting your belly, giving your baby a bit of a squeeze and then letting go.
Yeah. And it takes practice as well. And I think that's where it comes in to actually go see an osteo or, even like go and look at Chelsea's page, like see what it's all about and everything to get that personalized advice, I think is important. But the hugging the baby is like so good.
Yeah,
and like
it's a nice little connection exercise.
It also actually feels quite like even doing it now, so I'm like 21 weeks and you really feel the engagement. Like I feel like when you're that's basically all I'm trying to say. Like you really do feel the engagement where you can go, oh my goodness, like I can really feel my abdominals like almost working while I'm doing that. But it seems like such a simple exercise.
Yeah, absolutely. And again, it's probably more related to what you may do in labor. You might be on all fours and you're going to be contracting that way rather than crunches. We don't really need crunches.
Yeah. Love. We've touched a little bit on like pain and like what's normal, like from an osteo's perspective. And just before you also said like, just touching on the exercise thing, you said like maybe walking doesn't work for everyone because they might have like that pain. So from your like perspective, is pelvic pain, the pubic symphysis pain, back pain, is it inevitable? Or are we missing something? Like, is every woman going to be experiencing this?
Yeah, definitely not. Some people don't feel it at all. And again, that individual approach, maybe someone's had a bit of a back injury before or again, with the pelvic pain, like pubic symph pain, it might be a bit of an alignment issue or it could be more of an instability issue through the pelvis. So some people that are maybe more prone to having pelvic girdle pain and that pubic symph pain, again, depending on, I think the earlier the better in terms of getting treatment so we can try and stay on top of it. But there's things that we can use to at least manage that pain. If it is quite severe, we may not be able to get it to go away completely. I remember in that late stage pregnancy, but managing it,
I remember with my journey with Kodak, and I feel like I've gone into this second pregnancy very differently, like almost preparing my body pre-conception, on that physical level. And like I've had, my body's been so good, like apart from when I'm rolling over in bed, occasionally I'm getting that round ligament pain. Like you would know with Kodak, my back was a major issue. We had to focus on so much postpartum. We had to focus on so much. Yeah. And I think like something that really, really helped me was the belly band, how you showed me how to put that on properly. And that was just like, and that was just my own individual. That doesn't mean again, like it's for everyone, but I do think belly bands are great for every pregnant woman. What's your perspective on that?
Most most of my clients will use one.
Especially towards those later and specifically postpartum, just to support everything to like come back into place.
Yeah. I think they're a good like compression and helping postpartum. You can use them as well. Yeah.
Because also I remember like you think when you're pregnant, you're like, I'm not going to want anything on my belly postpartum. I've got this baby here now. Like I just want to feel free. But then once everything is trying to shift back into place and your uterus is, going back to normal size and everything, the support of that, like, everything being compacted, and it's like almost like a hug. It's
bit of a hug.
The best feeling in the world. Like I wore my belly band so much. I remember I even slept with it on like quite a bit postpartum. But again, like, as you know, that there was some things going on with my like instability and everything, and I couldn't walk a few times, and there was like just some stuff there. But I think even like all the prep I did, I think I'm still so glad that I did it all, because I think my back would have been a lot worse. Not having had, and like I remember you came to my house that day and you were like, did like a little assessment and everything. And it's like, if I had not done anything, I probably wouldn't have been walking for the first few months. Like I just had a few little flare-ups.
It's amazing what sometimes just small things can make a really big difference. Small things can make a big difference.
Love. I feel like we're getting like sort of to the end of our conversation.
Yeah, we could talk all day.
Oh my gosh, I know. I'm like, wait, we've actually spoken about so much. I feel like we've been 30 minutes and like so productive. This is a good question. How does birth, no matter the type of birth, maybe just touching on like vaginal versus cesarean as well, just like so women know, how does that impact the pelvis long term if it's not supported? And I feel like that's actually cool, coming off the back of even like my own like little story I just sort of spoke about, because I feel like if I hadn't been seeing like osteo and having that understanding of my body, having that support, this pregnancy I'm having now would be looking very, very differently. Again, individualized depending on the person and then the type of birth they end up having. So, for a cesarean, we will need to focus on, particularly postpartum, focus on managing the like scar adhesions. And I find probably a common one is women struggle to find like the activation of their lower abdominals after a cesarean. So that's important that we address that again, like sooner rather than later, because I'll see women in their like 40s, 50s that are like 10, 15 years postpartum and they're having issues, maybe because it wasn't addressed earlier on. So, can you still support those women though?
Yeah, absolutely.
Yeah, that's great.
Yeah.
Because there might just be some women listening going, oh my gosh, I gave birth 10 years ago. Like it's too late. But it's just never too late.
Yeah, absolutely. Yeah. And that's sort of that pelvic health stuff where, women might be experiencing a bit of incontinence. You hear it's so common. People go, oh, I've had kids, so I can't jump on the trampoline anymore, or I can't run anymore.
The normalization around
have to be.
Like the normalization around like wetting yourself after birth, or even in late pregnancy. Oh my gosh, guys, it's not normal, it's common.
No, absolutely. And there's things that we can do for that. And again, some of it can be quite simple. It might be something like, like if people say, a common one is people say, oh, during like flu season, it's the worst, because if they get a cold and they're coughing, that's when they'll wet themselves. So when we cough, we get an increased abdominal pressure, and down onto our pelvic floor. So our pelvic floor muscles and fascia is what sort of holds up our, all our organs and things, and our muscles around like, our anal and urethral sphincters stop wee and fecal matter coming out. So if they're all not working properly, we can have some leakage. And I guess a common one, like I was saying, if it's just when you have been coughing for a couple of days and those muscles are fatiguing, our pelvic floor has an anticipatory function. So before we cough, ideally our pelvic floor will contract and help us withstand that extra pressure. So it might be something as simple like that. We might have just lost that anticipatory function. So getting people to squeeze before they cough might be something that's really helpful.
Like doing it, like bringing that awareness that they're doing it themselves rather than...
Yeah, just to help those muscles. But yeah, again, it can be it's good to be assessed properly, because some people have, I was going to mention before the analogy I used with pelvic floor. I think of it like a trampoline. So we want good function of the pelvic floor, good tone. So if we have a really tight trampoline and we're jumping on the trampoline and it's really tight, think of those really shitty trampolines that you can't get much bounce on. We're not going to have much movement there. And then we have a real like saggy trampoline. We're not going to have much bounce there either, because there's not as much spring to it. But if we have somewhere in the middle where it's got good give and moves up and down, we've got good bounce then. So we want that good functioning of the pelvic floor where it can contract and it can relax.
Love. And I think like, again, like we've said, like actually having like a proper assessment is like how you're going to actually be aware of where your pelvic floor is at. And I personally think like it came into, like I had such an amazing like labor, birth, breathed my baby out. And I think it comes back a lot to, yes, the mindset, yes, everything, but also I had such an awareness of my pelvic bowl and like how to engage it for birth. And just, we worked on things that like maybe I didn't know were an issue, So I just think like it's just so huge. Like actually, if you are someone who's like comfortable with it, having like the proper like
internal,
which you do,
and on that, like I guess with perineal massage is a common topic.
I didn't do it.
No. But even like with the internal work you had, I remember you saying, it wasn't with me, but the internal work you had, I remember you saying, like, and like you just said, the awareness of where those muscles are. I think when you don't really know and feel what's in there, but having someone work on those muscles, you're like, oh, okay, I can feel where you are, and learning to then breathe through that. So with perineal massage, I've been trying to get people, it's not just about stretching those muscles. It's almost about, you might feel a little bit of pain as you stretch those muscles, and then breathing through that and learning to surrender to that sensation, because that may be a similar sensation that you feel during labor. It's not just about physically stretching them, but how your body reacts to that sensation.
Yeah, so true. And I haven't actually thought of it from that perspective of like, I actually had, I think I had 2 or 3 internal through my pregnancy, which helped me to have that connection to my pelvic floor. But I didn't want to do the perineal massage because it just didn't feel aligned with me. But I guess I did that, but with a practitioner.
Yeah.
So cool point to bring in, because I think a lot of the time perineal massage is sold as you're helping stretch your body. And it, like for me, I just didn't enjoy it. Like I tried it with Jai doing it, and I also tried it with myself. And I was just like, this just isn't something. And you got to pick and choose the things that you want to do.
Absolutely.
But I do love your point of actually, it's for some women, it's just for that awareness of like bringing the awareness to your pelvic bowl, because if you're not comfortable to see a practitioner, which I was, like maybe that's just like what will be your thing.
Yeah. Again, it's like completely, you don't have to do perineal massage to be able to give birth. But yeah, I think sometimes it's missed where it doesn't have to just be, you probably felt, oh, I was really uncomfortable, I didn't like that. But then you can change that to, I've got to feel a little bit of discomfort here. Like, let's just maybe back off a little bit with the pressure. Let's practice some breathing techniques. Like I know you work a lot with your clients about breathing techniques and meditation. You might find, let's just put a finger in and apply a bit of pressure, and let's maybe do a bit of a meditation and practice breathing through that and surrendering to that pain. And it's like what we would do as a practitioner with techniques. A lot of the time we're holding pressure, and then we wait for the body to give in to that pressure when it feels safe. So,
and it actually does, it softens, it melts into it. Hey?
Softens, yeah.
And then there's like that whole other topic which we're not going to get into because we'll be here forever, but just even how we hold emotions and we hold traumas and all the things in the pelvic floor as well, and that can be coming into play in why physically you're presenting the way you are. It's so interesting, hey, once you like really get into having that understanding. I think as like a Probably final question.
Yep.
We're yappa.
We're here all day.
What would your dream pregnancy support team look like for a woman?
Ooh. It's, again, individualized. I think, like, as I was saying before, I've got one of my best friends is a midwife, and she's amazing at what she does. And we've actually chatted about from what I offer clients and what she offers clients. And, you know, she's an expert in birth and having that all go to plan, but she doesn't have the time with her clients, but then also they don't understand the body in terms of what a more musculoskeletal practitioner like I do understand. So I really encourage people to, I think there is, I'm biased, but there's really good benefits in seeing a musculoskeletal practitioner, whether it's an osteo, a physio, getting massage, Bowen, all the things. I think we want to prepare, like the marathon, we want to prepare our physical body for that. Then I guess there's that support and emotional side of things where someone like you would be awesome. You know, even just making sure your partner is aware of things as well. If they're going to be in the room with you, they need to understand a bit about the pain and stuff as well, because if they see their loved one in pain and discomfort, they might freak out, and then that might freak you out, and so they sort of need to have a bit of an understanding there too. Finding the people that work for you and make you feel supported and safe, I think is really important.
Love that. And it's like very much taking that holistic approach to making sure that like women are having, well, like for you, like you're saying, like your dream team is really just ensuring the woman has that physical, emotional, spiritual support, really. Because all pillars are very important.
Absolutely.
And it doesn't have to be like spiritual woo-woo, but it's just more like that, you know, like just the energy even of the room, like you said, like the partner and like all the things. So I really do love that. Okay, so that was the last question, but I also feel like we'll just like wrap it up on this one. What does a woman who feels fully supported in her body during pregnancy and birth look like to you? Because I feel like at the start, you mentioned like the pain thing, and I feel like potentially, I don't know.
Hard one, but I think I always tell people, you know, there's different options in what they can do through pregnancy, you know, birth, definitely postpartum, but around the birth thing, I guess there's that big conversations with vaginal birth or cesareans and hospital and home births and all these options that you can choose. But I try and encourage people to, again, we touched on before, but what feels safest for them, because your body's going to feel supported and safe, and then I think that has the best outcomes coming into postpartum and, you know, minimizing birth trauma and that kind of thing. I think that happens when people feel unsupported, out of control, unsafe.
Yeah, safety's huge, hey?
Yeah, so I think there's pros and cons to different options, but what is going to work best for you and making you feel safe.
And I think that's like the whole episode we've really just been coming back to.
Yeah.
So it's like such a beautiful way to end it, because it's just like, actually what feels good for you. It's not about like what this person's telling you to do or what this person did. It's like exploring your options and rolling with what feels good for you, because it might not be quote unquote the right thing to do, but if it's what's right for you, then it's absolutely the right thing to do.
Yeah, absolutely.
Thank you so much for coming on the podcast as like my first official guest, like, which is so exciting.
Thanks for having me.
Oh my gosh. I'm like, also we're like friends outside of like, you know, being like me being Chelsea's client and everything. And I just feel like we have not had time to catch up in like a year. So it's just like actually perfect.
It was absolutely
so good. For those listening, where can they find you?
I do have a little Instagram page. I'm not super active on it, but I'm trying to be. That is Chelsea Mill Osteopath on Instagram. But I am based on the Sunshine Coast, so I work between a clinic in Noosa and Pomona at the moment, so you can find me there.
Perfect. I'll leave you linked below for those listening that might want a osteo treatment and to work with you through their pregnancy and beyond. But thank you again so much for coming on.
Thank you for having me.
I loved
it.
so good. And I'll be back in your ears next week. Everyone, thank you for listening. Bye.
Bye.